The whole cycle of the simple breathwork series takes about 6 minutes in its completion. If you're limited in time, just do the first breathwork exercise. That takes about 15 seconds. Let me instruct you on the breathwork series. The first breathwork is to take 2 sniffs up your nose, followed by a wide open mouth exhalation. 2 snorts or quick inhalations up the nose and then out the mouth. A long exhalation is encouraged. So in and out. In and out. In and out. In and out. I give a grateful nod to Dr. Huberman of Stanford in discussing this in one of his wonderful podcasts. Do 4 or 8 of these. Then comes the 4-7-8 breathing, where you count in your mind up to 4 as you breathe in through your nostrils, hold for the count of 7, then exhale through your mouth to the count of 8. The next is 4-7-8, where you breathe in through the nose to the count of 4, hold for the count of 7, and exhale through the mouth, either actively or passively, to the count of 8. Nasal inhalation. 1, 2, 3, 4. Hold. 2, 3, 4, 5, 6, 7. Breathe out. 2, 3, 4, 5, 6, 7, 8, and hold. Inhalation. 2, 3, 4. Hold. 2, 3, 4, 5, 6, 7. Release and exhale through the mouth. 3, 4, 5, 6, 7, 8. Dr. Andrew Weil on YouTube gives a lovely demonstration also. Do 4 or 8 of these. The last is left nostril breathing. Just take your right thumb to externally close your right nostril and just breathe through your left nostril for about 8 cycles of breath. In yogic breathing, the left nostril breathing relaxes you and the right nostril elevates you. The last technique is to take your right hand out in front of you, then come back and plug the right nostril externally with the thumb, and to breathe in and out at least 8 cycles of breath, if not more, just through the left nostril. In yogic breathing, the left nostril is for relaxation and the right nostril is for elevation energy. So we want in this case to close off some of that anxious energy, so we close the right nostril. None of these techniques have to happen in some contorted yogic position. It can be done in front of a TV. Any one of the techniques can be done in isolation. The effects of relaxation happen about 10 minutes later as the hormones in the body shift. The pulse usually goes down, as does the blood pressure. I do encourage that it be done before bed, as many commented that it helped them fall asleep and stay asleep. In today's world, there's already way too much excitement, so close that right nostril. This is a good one to do if you wake up in the middle of the night to get you back to sleep, to restful sleep. For each of these in the sequence, I encourage patients to do more if possible, because more is even more powerful. You will feel the effects of relaxation about 10 minutes later. It takes time for the hormones such as cortisol to shut off and other hormones to affect the relaxation. You don't need to be knotted up in a yogic position for this to work. Do the series twice a day and make it automatic like brushing your teeth. If you're in the midst of a tense situation, do the breath work of 2 snorts and mouth breath out to help you on the spot. When you're stressed out, your brain is already hijacked and you can't count on your hijacked brain to work your way out of stress. So do this active step to help you extricate yourself from the situation. I now introduce patients to this breath work as the initial approach to treating central serous and have really been astounded by the success and relieving the bump of fluid and regaining vision. I've had the more challenging patients, as many patients were referred to me to get the photodynamic cold laser therapy when the other methods mentioned previously didn't resolve the issue. I tend to see patients back about 5 to 6 weeks later, and I hear how the vision is doing, and then I get the OCT to follow the fluid. I've seen both full and partial resolution. When it's partial resolution, I encourage the patient to conscientiously continue the breath work, and voila, it usually is resolved by the following visit. I always reassure the person that the photodynamic therapy with verteporfin is always available as an alternative should the person wish to proceed with that treatment. So I present you with some food for thought on this novel treatment for central serous and for just general well-being for all. Consider giving it a try. Happy breathing.